Hello guys, hello Tanzania, hello to the world. My name is Jacob Wilson, the modulator of nursing and medical sessions. Today we're going to have our sessions on nursing and medical sessions that go on online on YouTube, and today we're going with the subject of nursing, of medical and surgical studies. Today we're going to have an introduction on nursing and medical studies, and today we are going to have a lot of things to get the introduction and overview. But before we move on, how are you seeing 2019? Today is just the third day of the year 2019. I hope it's doing good with you. I hope things are doing good with you. May I take this chance to wish you a happy new year. May I take this chance to wish you more blessings, more joy, more happiness, more everything, more success in 2019. I hope 2019 is your year. I hope 2019 is a good chance, it's a new chance to you. Please make it and use it positively, it will build you. You most welcome. Let us move on with our session whereby, as I told you, we're going to have an introduction on medical and surgical sessions. So today we're going to take an overview, on nursing and medical sessions. You're most welcome. Be with me. My name is Jacob Wilson. Don't forget to like, share, to comment, and even to subscribe on our YouTube channel so that you can get more updates. You're most welcome. Thank you. As I told you, you will be here with me, your modulator, Jacob Wilson, a registered nurse by profession, and our module name will be Medical and Surgical Sessions. And today we're going to use only 10 minutes in our sessions. By the way, we are going to look at the introduction to medical and surgical studies. This will be our learning tasks, whereby we have to understand the following at the end of the session. The first thing is to define different terms related to medical nursing, surgical nursing, disease, illness, and sickness. We should also identify the cause of diseases. We should also describe the disease process. We should be able to list common medical disorders. These will be our learning tasks. These are the few things that we're going to have and to pass through in our sessions. The medical terms, the common medical terms are as follows, whereby the first one is medical condition. This is an abnormal condition of an organ that impairs the body function associated with specific signs and symptoms. This is a normal condition that occurs to a specific part of the body that impairs the normal functioning of the body. The body fails to function as normal. It is always associated with specific signs and symptoms. So for instance, there is a normal condition in the head. It's always associated with signs and symptoms such as headache and whatever. Another medical term is surgical nursing. What is surgical nursing? Surgical nursing is the nursing career which focuses on care for surgical conditions. When we say surgical condition, these are interventions done on the body which involve tearing of the body. These are surgical conditions. What do we mean by the term disease? Disease is a normal condition of an organ that impairs body function associated with specific signs and symptoms. So disease is an abnormal alleviation of normal health. That is the disease. When the body changes from normal to abnormal, that is the disease. And it impairs body functions. It impairs the normal functioning of the body. It has specific signs and symptoms. Headache, fever, whatever, those are the normal signs and symptoms. So that is the disease. What do we mean by the term illness? Now we have to differentiate between the term disease and illness. The term disease and illness. As I told you, the term disease is that the body impairs. The abnormal condition impairs the normal functioning of the body. But when we come to illness, this is an objective diagnosis that an impartial external observer is able to make to constellate of symptoms which the patient presents. So the person outside can make a judgment to a person who is sick using the symptoms. That is what we mean by illness. So when someone sees you and asks you, are you sick? And you are truly sick, that means he knew that you have illness, you are ill. But when it comes to a disease, that now the disease is that it's an abnormal condition, it's already in the body. But with this illness that someone can detect from outside through the signs and symptoms. So that's the difference between illness and disease. Pathogenesis comes from the Greek words. Pathos means disease and genesis creation. This is the mechanism by which the disease is caused. And etiology, this is the study of all factors that may be involved in development of diseases, including the susceptibility of the patient. Susceptibility of the patient, it means immune of the patient, the nature of the agent, and the way in which the patient's body is invaded by the agent. So this will be the most common term that will be used in our medical and surgical studies. As we started with the first one, it was medical condition. The second is surgical. The third one is disease, and the fourth is illness. The fifth, pathogenesis and etiology. Now let us come to see the causes of the disease. All diseases develop in different ways. As we know, there are various and there are a lot of variety diseases in this whole world. There are some diseases even we have never seen them, but we know they are there. So diseases are common in different ways, are formed in different ways. So as we can see, the causes are infections such as pathogens. There is an injury, for example, fracture, toxicity from poison, deficiency, e.g. anemia. There are metabolic disorders. There are causes from the environment. There are causes from emotional stresses. These are mostly mental diseases. And there are causes from hereditary. These are, we heard it from our parents, from generations. And these are diseases from unknown origin. We call them idiopathic causes. So there are a lot of causes that cause diseases, and that's why diseases are very many in this country, in the whole world. So you're most welcome with me to take a better look at how things go, how a disease occurs. Now let us look at the disease process. How does the disease manifest in our bodies? How does the disease come into act in our bodies? The disease process, the disease is a structure and functional change in the body that is harmful to the person. So when the disease gets into the body, it disrupts the structure and function, of your body. So it changes, that comes into a harmful state. So disease process may develop through a variety of external and internal influences that include, for example, trauma, infection, poison, loss of blood flow, autoimmune, in heredity or acquired genetic factors or errors of development. So as a disease, it comes from different, both internal and external influences. There are a lot of things. So from external, we have something that like pathogens, environment, and whatever. From internal, we have something like our immune system. How does it accommodate the pathogens? That is how we come. So the cells or tissues of the body may be injured or destroyed by any of the agents that come. So when the pathogen gets into the body, they destroy the cells and tissues of the body. When they get injured, we come to something that is an inflammatory response from the body. The body acts by an inflammatory response. An inflammatory response, what is it? It's inflammation. And inflammation is a defensive reaction intended to neutralize, control, or eliminate the offending agent and to prepare the site for repair. So when something enters into the body, pale ambapo vimelea vimeingia kwenye mwili, vinaenda vinazuru tishu na seli mbalimbali kwenye mwili. Vikishazuru mwili unachukua hatua ya uvimbaji, tunaita hatua ya utanuzi, ambao ni inflammation. Kwa hiyo linachukua inflammation process so as kuneutralize, kucontrol na kueliminate zile agent, vile vimelea vilivyoingia katika mwili. So it involves changes in microcirculation, including vasodilatation, increased vesicular permeability, and leukocytic cellular infiltration. Kwa hiyo when inflammatory response takes place, it has a series that goes on, and that series, it includes microcirculation. It increases more circulation, more supply of blood to the body. It included vasodilatation, whereby the vessels, the veins, and other blood capillaries expand, and increased vesicular permeability, whereby blood can be easily transported from one place to another, and leukocytic cellular infiltration. The white blood cell come to the area of the site of infection, so that to fight against the pathogens. So as these changes takes place, the 5 cardinal signs of inflammation are produced. So during the body trying to resist against the disease, there are 5 cardinal signs of inflammation that exist. The first thing is redness. Due to high supply of the blood to the site of infection or to the site of the disease where it took place, redness due to more supply of blood, there redness occurs. Another thing is heat due to that massive friction and movement of blood from different parts of the body to the site. Another thing is swelling. As I told you, inflammatory process is accompanied by swelling and pain and loss of function. So another thing is leukocytes. White blood cells collect in the vessel, exit and migrate to the site of injury to engulf offending organism. So the white blood cell will move to the site of infection and fight against the invading pathogens, the invading poison or the invading pathogens or organisms that need to enter. So these are the common medical disorders. So by the way, this is the short disease process as it takes in the press. So it's simply that when the body is invaded, it's invaded into when the disease gets into how the disease gets into the body through pathogens or any other thing. And when it's getting, it distracts the structure and functional things that are harmful to the body. So what it is, it affects the cells and tissues. So when those cells and tissues they are affected, the body gets an inflammatory response, whereby through the inflammatory response, that the body is going to swell, and when it swells, it is associated with different series of activities such as vasodilatation, vesicular permeability, and leukocytic cellular infiltration, whereby everything will work together so as to make the body safe. So vasodilatation is that blood vessels will increase in size, will dilate, and microcirculation, blood supply to different parts of the body, especially the site of infection, will increase. And leukocytic cellular infiltration is where the white blood cell will move to the site of infection so as to fight against the pathogens that need to get into the body. I think we are together. And we have the 5 cardinal signs whereby when inflammatory response takes place. The first thing is redness, as I told you, due to massive supply of blood, heat, swelling, pain, and loss of function. So that are those we can say are the most common. Though that is the short process, the disease process, how it takes place. When the disease gets in the body, what does the body do to the disease? That is what happens. Now let us come and see what are the common medical disorders by system. Among the causes that we mentioned are medical disorders, system disorders. Among the here the metabolic disorders. Now let us come and see what happens in different systems of our body. The following are the systems of the human body where the disorders can occur. The first thing is in the circulatory system. Disorders are such as hypertension and heart failure and varicose vein. Hypertension, that blood rises from normal, either systolic increases by 15, diastolic increases by 30. That is hypertension. Heart failure is when the heart fails to pump enough blood to other parts of the body, and varicose vein. This is excessive inflammation of the veins. So another thing is respiratory system disorders such as pneumonia, bronchitis, and common cold. Another system is immune system, whereby its disorders are such as HIV and AIDS. And another system is the skeletal system. Its disorders are such as osteomyelitis and arthritis. Osteomyelitis is the weakness of the bones. Arthritis is the infection in the bones. And another system is the excretory system, whereby the disorders are such as skin diseases. Another system is urinary system disorder. The disorders are such as renal failure, nephritis, UTI, urinary tract infection, and so on. So the muscular system, it has also disorders such as gangrene and spleen. Endocrine system has disorders such as DM, which we call diabetic mellitus, and thyroid diseases. And also digestive system disorders are such as intestinal obstruction, peptic acid diseases, PUD, and another thing is hemorrhoids. Tunaita mbawanine, yeah, something like that. Another thing is nervous system disorders such as neuritis, infection in the nervous system, especially to the spinal cord, and encephalitis. Another thing is reproductive system disorders, whereby we have menstrual disorders in female, fertility disorders in both male and female, phimosis in male, and uterine fibroids in female. So these are the key points whereby disease can be caused by variety internal and external factors. Inflammation is characterized by 5 cardinal signs, whereby is redness, hotness, pain, swelling, and loss of function. Inflammation is a defensive response of the body to the disease and illness, and it is an important part of the healing process. So that's what happens to healing process. So when the body reacts from inflammation to the last point of leukocytic infiltration, and it succeeds to invade the pathogen, that's when you recover from the disease without even getting treatment. Otherwise, when they get into the body and you have a low immunity, is when it invades and manifests so much, you become more weak and the disease attacks you. You need to use more. So that marks the end of our sessions. As I told you, we had an introduction. As we saw, we had medical sessions. We had medical terms, as we saw. We had the term medical condition, nursing condition, illness, diseases, pathogenesis, and other more. So that's the little thing that we can share today. I would like to thank you for being with me, supporting me since day one, and I would like to thank you for your time, to thank you for your humbleness, for everything that you have shown me. Please and please share, like, comment, and subscribe to our YouTube channel. Share this video to most people. Share the link to people so that they can have this education, they can have these good things. Even God will bless you because you are trying to save someone's health. You are trying to have good things to other people. This year is 2019. We have to make people's health better. So through these sessions, we can have different ways of how to prevent ourselves, to have awareness to understand different medical conditions, different things in our sessions. You're most welcome. Be with me, Jacob Wilson. I would like to wish you a good day. Enjoy the year 2019. Thank you and you're most welcome. My name is Jacob Wilson, a registered nurse by profession. Thank you. May God bless you. Ciao.